Sophie had always been told that her period was normal. Every woman has cramps, her friends will say. Just take a painkiller and push through. But Sophie's pain was different. It wasn't just cramps. It was a searing ache that left her curled up in bed for days, unable to function. It wasn't until years later that she was finally diagnosed with endometriosis, a condition that affects millions of women but is still surrounded by myth and misconceptions. As Sophie sat in the waiting room of her doctor's office, she thought about how long it had taken her to reach these points. How many myths had delayed her understanding and diagnosis. If only she had known sooner what endometriosis really was. She wanted to share what she had learned to help others avoid same confusion. Now let's look at some of the myths surrounding endometriosis. Number 1. Endometriosis is just bad period pain. Sophie remembered how at first, even her doctor dismissed her symptoms as normal menstrual pain. But endometriosis is much more than that. The condition occurs when tissue similar to the lining of the womb grows outside of it, on organs like the ovaries, fallopian tubes, or even the urinary bladder. This causes chronic pain not only during periods, but at other times as well, often leading to fatigue, bowel issues, and even pain during intercourse. My pain wasn't limited to just my periods, Sophie thought. I felt it was all month long. It was affecting my entire life, and I wish someone had told me that wasn't normal. Number 2. If you have endometriosis, you can't get pregnant. When Sophie's doctor mentioned this common misconception, she was shocked. Endometriosis can make it harder to conceive, but many women with the condition do have children, sometimes naturally and other times with the help of fertility treatments. I had always feared that having endometriosis meant I couldn't have a family, Sophie said. But I've learned that it's possible, even if it takes more time or medical help. Myth number 3. You only get endometriosis in your reproductive organs. Sophie once thought that endometriosis was confined to the uterus, ovaries, and fallopian tubes. However, the disease can spread to other parts of the body, including your urinary bladder, bowels, and even the lungs in rare cases. I had bladder pain that no one could explain for years, and I never connected it to endometriosis until I was diagnosed, she reflected. Knowing that endometriosis can affect more than just the reproductive system helped me understand why my symptoms seemed so widespread. A hysterectomy cures endometriosis. Sophie had heard people suggest that if she had her uterus removed, the endometriosis would go away. But this wasn't true. Endometriosis is caused by the growth of tissue similar to the uterine lining outside of the womb. So removing the uterus doesn't necessarily stop the condition. A hysterectomy might help some women, but it's not a guaranteed cure, Sophie explained. The endometriosis can still grow elsewhere in the body, so surgery needs to be carefully considered. Myth number 5. You don't need treatment if your symptoms aren't severe. Before her diagnosis, Sophie felt that her symptoms were just something she had to live with, especially since they weren't as severe as some of other women's experiences. But endometriosis isn't just about pain. It can lead to other health issues, including infertility if left untreated. I thought some of my symptoms were manageable, so I put off getting help, Sophie said. But even if your symptoms are mild, getting an early diagnosis can help manage the disease and prevent long-term complications. As Sophie left her doctor's office, she felt a sense of relief. She knew the road ahead wouldn't be easy, but she was armed with the knowledge she wished she had had years ago. There were still misconceptions about endometriosis, but by sharing her story, Sophie hoped that other women would seek help sooner and not wait as long as she had to get the answers they deserved. If you found this video helpful, please give it a thumbs up and share it with other people who might benefit from it. Don't forget to subscribe to my channel for more videos on health, wellness and medical insights, and hit the notification bell so you never miss an update. Together, we can spread awareness and empower people to take control of their health. Thank you very much for watching.